In another big step to post-COVID normality, the government is scrapping mandatory quarantine for infected individuals from the end of this month. Asymptomatic patients can go to work, but infected students are advised to stay away from the campus. Macy Mock reports.
Starting from the 30th of this month, people who contract COVID will no longer have to quarantine. In another major policy change, health authorities will no longer ask infected individuals to report themselves, and all isolation orders will expire.
The reason is all related to our higher immunity barrier, the fact that our healthcare system is much more prepared, and even our whole community and our citizens have actually better knowledge and ability to handle the infection. The disease is now milder to the fact that we don't think an isolation order is warranted.
Those infected are still advised to observe a list of health guidelines. Center for Health Protection Controller Edwin Cho urged positive patients to wear masks in the public at all times in the first 5 days. They should also avoid eating with others at the same table and avoid going to crowded places. People without symptoms can go to work, but infected students should stay home until their rapid antigen tests turn negative. Labor Secretary Chris Sun said workers who wish to take time off and recuperate from COVID can simply visit a doctor and ask for a medical certificate. The arrangement is no different than applying for an ordinary sick leave. Sun reminded employers that if they do not wish infected workers to return to office, wages must still be paid in full. Quarantine centers will remain open for anyone who wish to isolate themselves, but only Hong Kong residents are eligible, and they must leave after 7 days. The government will also phase out telephone medical consultations for COVID patients. COVID oral drugs will be dispensed from around 70 government outpatient clinics if needed. Macy Mock, HKIBC.